Hello everyone and welcome to today's presentation on vitamin C and cold, myth or truth. Okay, first of all I want to apologize because this presentation came a bit late. Okay, so it's been around 2 weeks. I was really busy with university and work, and also, as you know, all my presentations are scientific based, so it takes me quite a while to research everything. Okay, I want to just bring you the best of the best. Okay, my name is Filippo Ceccagno, for those of you that doesn't know, and I am a nutritionist registered in UK, also personal trainer, fitness instructor, whatever. Okay, and I'm really interested in nutrition. I'm doing my master in genetic and nutrition, so how DNA affects nutrition and how nutrition affects DNA. So it's really important, really exciting. So the topics of today, we're going to look at what is vitamin C, the population and statistics. So we're going to see how globally vitamin C is affecting us, what are the status of vitamin C right now in the population. Also, we're going to briefly touch on food sources. We're going to look at the role in the body, so what vitamin C does in our body and why it's so important, and then we're going to at the end look at vitamin C and cold. We're going to check two meta-analyses, so big studies, which are really important to understand whether vitamin C is helping or not therapeutically against cold, because we know that pharmaceutical companies are using vitamin C to promote their drugs, okay, and they often combine vitamin C with like paracetamol and so on to fight against cold. And we're gonna see which is if it's actually true and it's worth spending money on this vitamin and so on. And then we're gonna draw some conclusion, obviously, together, try to understand whether what is important to take from this presentation home. So what is vitamin C? It's also known as ascorbic acid or ascorbate. Okay, vitamin C is a water-soluble vitamin, so it means that it easily dilute in water, and it also means that we are not able to store vitamin C compared to other vitamins that are fat-soluble, like vitamin K or so on, which you can actually build up as storage. Is mainly obtained through dietary intakes. This is because we are not able to synthesize vitamin C in our body. Some animals are able to synthesize vitamin C. This is because they have the enzyme gulonolactone oxidase, okay, which is working on glucose, and they synthesize glucose in vitamin C. We are not able to synthesize it because we don't have this enzyme anymore. And human can actually get vitamin C from different sources, okay, which is our fruits and vegetables. It's mainly absorbed in the small intestine, and if the concentration in the small intestine is really high, the absorption rate will decrease dramatically. So let's have a look at vitamin C and the reference nutrients intake. What are the reference nutrients intake in UK? Because I'm based in UK, but I also work for anyone else in any other part of the world. So as you can see here, I highlighted with red boxes, okay, where vitamin C stand, okay, which one is the column that we need to look at. And as you can see, the reference nutrients intake is 40 milligrams, okay, per adults, and 50 milligrams for pregnant women. So as you can see, you just increase of 10 milligrams for a pregnant woman, and then in lactation, it's 30 milligrams. Is 30 milligrams. So as you can see, reference nutrients intake it's estimated to cover 97% of the population. So there's still 3% which for some reason these numbers are not enough, and we look at the reason later on as well. So let's have a look at vitamin C serum reference values. This is very important, this table. We use it. There are many others, because this is just few of the biomarkers which we can look at. And this is usually used when we do blood tests. So we look at this reference table to understand whether a person has any kind of problem. So I didn't highlight it here, but vitamin C, as you can see, it's here, okay? And there are conventional units and other units which are used. The conventional unit, the normal range is between 0.4 and 1 milligram per deciliter, and in the other units it's between 23 to 57 nanomole per liters. We're going to look at nanomole per liters because it's what we use in UK to look when we do blood tests. Okay, so in hypovitaminosis, the range is between 23 and 28 nanomole per liter, which means that you have low intake and low levels of vitamin C. So you are at risk of vitamin C deficiency. And this is the range. So when you have 23 to 28 nanomole per liter, we classified you as a risk, high risk of deficiency. Then we go less than 23 nanomole per liter, which means that you are deficient in vitamin C, and it's really bad. And then we got severe deficiency, which is below 11 nanomole per liter. And trust me, you don't want to be there. It's a really bad state, and the disease that comes with it is terrible. Okay, we're gonna look at this in a minute as well. So here we look at the population and the status of vitamin C in different countries. Here we have a study carried out in 2020, and I think it's one of the most comprehensive. And as you can see here, I extrapolated some graphs, and we can look at the graph. In the graph A, we look at the vitamin C status, and we go high income countries, which is HIC, and then we go low medium countries, which is LMIC. Okay. And looking at this graph, we can see that actually the vitamin C status, if you remember, between 23 and 28 you are in hypovitaminosis, is for low medium income countries, it's just there. Okay, so they are at risk of vitamin C deficiency. They are already in a state of hypovitaminosis, and this is on 19,000. 9,000. I don't know why I was saying 19. 9,000 people, okay, participants. This is huge, and 52,000 participants for the high-income countries, and as you can see, it's over 50 nanomole per liters in high-income countries, so they're quite safe, let's say. Then we go graph B, which is vitamin C intake, and this is, as you can see, again, if you remember, it was the normal reference intake is 40 milligrams per day. If you are below that, your risk of hypovitaminosis and deficiency. And as you can see, low medium income countries, they are not even close to the threshold, okay, of 40 milligrams. They often have less than 40 milligrams per day. And this is obviously logical if we watch the graph A, okay, so we can expect this. Now, the graph C is where things start to be interesting. Okay, so if you see, this one is looking at the percentage of hypovitaminosis in vitamin C in different countries, and look at the low medium income countries, guys. Almost 80% of people are in a state of hypovitaminosis. This is terrible, guys. Give me goosebumps. That means these people are at risk of very bad diseases. Okay. And then I'll switch off my camera 1 second so you can see the graph D. And as you can see here is the percentage of vitamin C deficiency in different countries, and look at the low medium income countries, guys. I mean, that's unbelievable. It's more than 50% of people is in a state of deficiency. And as you will see in a minute, what does it mean to be in vitamin C deficiency? Let's have a look at the next slide. So in this one is a graph again from the same study, and it is another way to look at the different graphs that we looked at before. As you can see here, in the bottom axis, we got the vitamin C stated in nanomole per liters. Again, if you remember, when you're here, you are deficient below here, or hypovitaminosis here. Okay. They generally stated that the yellow color is for the hypovitaminosis, so they also comprehend up to 50 nanomole per liters. But that's because it depends from which country are you from and where the study was made. But if you see big bubbles mean big sample size, and small bubbles it means small sample size. So it's all relative, okay? But anyway, as you can see, let's have a look at the red zone, and this is where people is deficient, And look, most of them are low medium income countries, okay? And as you can see, even on the yellow zone, we got a lot of countries which are doing well economically. So Japan, USA, UK. So we're not out of the risk, okay? So let's have a look at the next slide. So what is vitamin C? Let's have a bit of background on vitamin C. So vitamin C is in two forms in our body. Is in ascorbate, which is the reduced form, is the common form, and then we have the dehydroascorbic acid, which is mainly present found in cell, and is the oxidized form of ascorbate. Okay, so the most common is ascorbate, as I said, and is a stronger reducing agent. So it has the ability to donor electron, and we will see later why it's so important. Vitamin C also has a neutral pH, and as we said before, is water soluble, which also means that we are able to actually diffuse vitamin C via plasma membrane at a really slow rate, okay, and then in high concentration as well. So the highest vitamin C diffusion is thanks to the orally administration of ascorbate, okay, and the diffusion of this vitamin is carried out by different proteins, which we will look later on, okay, but mainly also GLUT1 and 2, and then we go SBT, and we're gonna look at this in a second anyway, okay, so just to make you understand better. And also what is so important is that ascorbate, so ascorbic acid, is actually competing with glucose, okay, when it's trying to be transported in the cell. So it's competing glucose, and we will see why in a second, because they use the same carrier, okay? So that's why. So if you have a high concentration of glucose, it means that you might have a low concentration of vitamin C, even if you have a high vitamin C intakes. So it's really important your diet, guys. And then another really important fact is that vitamin C is so important for the brain that if we are in a state of hypovitaminosis or vitamin C deficiency, most of the vitamin C is retained in the brain at the expenses of the other organs. This is because the body is trying to preserve vitamin C levels in the brain because it's so important for reducing ability skills, okay, and so it has a protective effect on our brain. So that's why our body try to preserve it as much as they can in the brain when we are in a state of deficiency. So vitamin C metabolism, and here we're going to look at the different proteins. As you can see here, there are two different proteins. We got the GLUT protein transporter and the SVCT transporter. Both of them are SVCT1,2, and then we got GLUT1,2, okay? So as I said before, that's why this is the protein where vitamin C will compete with glucose, because this is mainly a glucose transporter, but it will also transport DHA, which is the oxidized form of vitamin C, okay? So the vitamin C, the metabolism of vitamin C is linked to its antioxidant properties. So as we said and briefly touched before, vitamin C has the ability to donor electron, okay? So is a strong electron donor, and that's why is referred to us as an antioxidant. This is because if we have free radicals in our body, free radicals are molecules which are a bit crazy, okay, and they are looking for electrons. So they are missing one of the electrons, and they go around trying to look for electron. If there are no antioxidants, which are molecules which they're able to donate this electron, these free radicals will go in the cell, cause some damage in order to get this electron, okay? So that's why it's so important, vitamin C. As we said, vitamin C is a reductone, okay, with two hydroxyl groups. So that's where the electrons are, which makes an efficient electron donor. Ascorbate is oxidizing ascorbic free radical and then to dehydroascorbate. So this is happening in the cell. So the ascorbic acid is entering the cell as an ascorbate. It gets reduced to DHA, and in some instance, by enzymatic means, it gets how do you say re-synthesized in ascorbate, and we will see this later. So also ascorbate is oxidated in the gastrointestinal tract, and as we said here before, SVCT1 and SVCT2, sorry, are the carrier for this vitamin. Okay. Then if you want to read about this, it's not really important, but anyway, there are different tissues with different concentration of vitamin C. Now, vitamin C in human, why is so important in human? Okay, so, and we're going to look in slowly at the role of vitamin C in human. So, as we said before, in contrast to different vertebrates, so different animals, humans are not able to create any more vitamin C. This is because the gene that is expressing the enzyme L-gulonolactone oxidase is actually switched off. So we're not able to create any more this enzyme. So we need to get vitamin C from different dietary foods. Okay. So why this happened? Why this gene stopped working? This is probably an evolutionary process. Okay, and because vitamin C was probably found in abundance in different, as we said, different foods, and our body became so efficient in the absorption, which we didn't need anymore this gene, basically this enzyme. So we stopped using it. So the sodium vitamin C transporter, this family of proteins which we looked at before, are the one that handle the transportation of vitamin C inside of the cell. What we know so far is also that if you have a knockout of the gene that is expressing SVCT2 or 1, which are the carrier protein, there is a sudden death. And that's terrible. So it means that if a person doesn't have this gene, basically this person ceases to exist because he won't be able. So if a baby born without this gene will die in few minutes from respiratory failure. Okay. Vitamin C levels, and this is really important. We are not all the same, and we know. So we have different needs. And this is because we may have different genetic mutation. So we are smoking, we are drinking alcohol, we have a different underlying condition, and all of these impacts our needs. Okay, so in terms of vitamin C, so the intakes vary differently from person to person. So if you have a certain polymorphism in your genetic makeup, you might metabolize vitamin C in a different way or less, which means that you need higher intakes of vitamin C. So it's important to look at each individual and not generalize. Okay, so that's why it's so important personalized nutrition, and that's my job in general. Okay, so vitamin C in humans again. Vitamin C can act as an antioxidant, as we said before, and is important in different body physiological reaction. As we said before, is oxidized to ascorbyl radical, and as I mentioned it before, DHA, which is the hydroascorbic acid, is often reduced back to ascorbate by enzymatic means for recycling in the cell. Okay, so as we said before, if you remember in the image, it enters the cell, it gets oxidized to the hydroascorbic acid, and reduced back to ascorbic acid if needed. Okay. However, these processes are impaired if you have different polymorphism, or if you are a smoker, you take some drugs, medication, and so on. Okay, so it depends from person to person. So what is the role in the body of vitamin C? Why is so important vitamin C? So vitamin C is an essential cofactor in collagen biosynthesis. And I want to repeat this. It's an essential cofactor in collagen biosynthesis. Do you know what is collagen? Collagen is a protein and is a major component in different connective tissue, okay, such as ligament, tendons, skin, and other organs. That's why it's so important, guys, and that's why it's so important also in sport and so on to have enough vitamin C. Because if you don't have enough vitamin C, you're not able to synthesize collagen, and you will suffer badly. Okay, is a cofactor for carnitine, so in energy metabolism and fatty acid transportation. I will do a presentation on carnitine soon and sport nutrition, so stay tuned. We will look at that. Is a cofactor for catecholamine metabolism, and also is essential to increase dietary iron absorption. And this is so important, guys, because it's mainly for women as well, which as we know, they have their menstrual cycle and they lose a lot of blood, so they lose also iron. So if you have low level of vitamin C, the absorption of iron is impaired. So it doesn't matter if you have a high iron intakes, if you don't have vitamin C in your body to increase the absorption of iron. So you start to understand why different micronutrients are so important. So we think that, okay, we take this food, which is high in vitamin C, and we forget about other stuff, but they all work synergistically. So it's so important that our diet is complete, okay? So it needs to be balanced. And you will see, as we get over and over again in different presentations, we talk about different compounds. And these are really important. It's really important that your diet is balanced, and we try to get as much as we can of everything, and also it's personalized to you guys, because each of you has different needs, has different DNA makeup. We are all different, okay? So we have different needs, and we need different intakes, okay? So it's so important that you understand yourself and your body. Anyway, sorry. Brain consumes 20% of the oxygen in our body. So it makes it really vulnerable and susceptible to oxidative stress, which is the free radicals that they go and basically damage our neurons. So that's why vitamin C is essential to prevent memory alteration. Being really a reductant, so being a really good electron donor, it has a protective effect in our brain, which there is high concentration of oxygen, which makes make it able for vitamin C to donor this electron to free radicals to stop oxidative stress. Okay. Now let's have a look at vitamin C deficiency. This is so important, and now we start to understand what is happening in different countries, as we said before, globally, when we have in low medium income countries vitamin C deficiency. We can't see it right now with our eyes, because obviously most of us, not most of us, some of us are living in high income countries, so we're not exposed to these different problems. But trust me, some countries are in a bad position, okay? So, and some of them have a really difficult time, okay? So let's have a look what is vitamin C deficiency. 70 to 90% of vitamin C is absorbed from 30 to 180 milligrams per day. That's why our reference nutrient intake in UK is 40 milligrams, okay? So this should be minimum enough to give you enough vitamin C in your body. Above 1 gram per day, the absorption will fall to less than 50% because we have too much of vitamin C, and the excess of vitamin C is excreted in the urine, okay? So vitamin C deficiency arises when there are decreased intakes of vitamin C, obviously, and the requirements are different. So if you have polymorphism, you might take in 40 milligrams per day, but you're not able to absorb properly vitamin C. You absorb, I don't know, at a rate of 50% compared to me that I have the normal gene. And that means that you will need to increase your vitamin C intakes to double the reference nutrient intake. Otherwise, you're at risk of deficiency and hypovitaminosis. This is why it's so important personalized nutrition, okay? So the most at risk are elderly, who is using alcohol, anorexia, cancer, so malnutrition. Food fads. What are food fads? Food fads are people that are doing different diets, okay? So the food fads are different diet, and mainly, in general, is a lot of these diets, they cut out really important macronutrients, and staple food like carbohydrates and blah blah, like carnivore diet, which you eat really little of vegetables, all these diet which are extreme, they put you in a place of risk. That's why it's so important balance diet. That's why it's so important that you understand your body and you have a knowledge of nutrition. That's why you need sometimes professional to help you and not just stick to, I don't know, whatever you see on BBC and they say, oh, carnivore diet, they made me lose 15 kilograms. Good, they made you lose 15 kilograms. Maybe you're not performing as much as you should. Maybe your performance decreased and you didn't realize. Maybe you're not, especially if you're an athlete, you're having problems in beating your PRs and so on. And some other people may be a really risk of deficiency. I knew a person which she went vegan from one day to another. She started losing hair after 3 months because she was deficient in vitamin B12. And she didn't understand nutrition, she didn't understand how to integrate the vegan diet. So it's not that easy as we all think, that you just change and that's it and your body's functioning. It's not like this, okay? Then other personal risks are the person that are smoking, taking medication, who has, people that has renal failure. This is because the filtration of vitamin C during dialysis. And then we got liver transplant as well. So vitamin C deficiency. The disease that comes from vitamin C deficiency is scurvy. Some of you may know this term, okay? It usually develops after 1 to 3 months of deficiency, so it takes a while before to develop. And the first symptoms are lethargy, fatigue, malaise, and then you go emotional liability. We found often this with micronutrients that depression is an outcome from vitamin C deficiency and also hypovitaminosis. That's why it's so important, especially in mental health nutrition. Then we go weight loss, anorexia, diarrhea, and then it started really bad symptoms of scurvy. We go easy bleeding for poor cuts, so poor cuts healing. So we get a cut and we keep bleeding and bleeding and bleeding because our body is not able to create collagen, and the cell needed to repair the cut. And then it starts the manifestation in the skin. This is where the things start to get nasty. So we got the prinoderma, we got corkscrew hair, perifollicular hemorrhage, edema of the lower extremity. So often we see bleeding gums, okay? People start losing teeth. Then we got bleeding from the hair follicles. That's terrible. And then when the things start to get really, really bad, we got hemorrhages all around the body, okay? And people start to get paralyzed when they are really, really deficient because they have hemorrhages intramuscularly and articularly, so they can't move anymore. And then the bones start to bowing. You don't have collagen anymore, so your bones start to get soft. And then eventually you will die because your body starts to break down completely. Okay, there is no intoxication from vitamin C because it's expelled by urine. However, if you have too high vitamin C intakes, you might have diarrhea or intestinal discomfort. So now you understand that in this country, low medium income countries, they have 55% incidence of deficiency. That's incredible. So it means that there are a lot of people that might go over the symptoms, guys. And the way to treat vitamin C deficiencies is by taking vitamin C. So you take around 300 milligrams a day for a month, up to 3 months, and you start, I mean, the symptoms start to reverse really quickly. So it means that these countries put them are in really bad place. I mean, the poor people, they're suffering a lot. Now, vitamin C and upper respiratory tract infection. So this is what we are here for today, to understand why vitamin C is important in preventing cold and so on. So the first study is a meta-analysis, is carried out in 2013, and is I think from my understanding and from my research, is the most comprehensive study to date. Okay, it's 2013, so it's not that recent. Okay, however, they look at 63 placebo controlled studies. So they use a randomized controlled trial studies, which are the gold standard for intervention, and to give conclusive answer to different scientific topics. Okay, so as we can see here, I'm not going through which study they went because it would take us so long. We got the risk ratio over here. And then the conclusion is basically the vitamin C supplementation actually failed to significantly impact the incidence of cold in the general population, but they see that it may be beneficial in people that is doing severe physical activity, so athletes. However, this was on 5 trials, as you can see here, involving athletes, so the sample size is not that big, so we might need bigger studies. And the supplementation, they found that they may reduce cold duration. However, this is not being replicated consistently, so that they can reduce cold duration. Now let's have a look at some slides which are really important to understand. So this is a forest plot, okay? So this is a graph which is extrapolated from this meta-analysis. And as you can see here, this line is where significancy is staying. So if any of these line is touching the significant line, it means that these studies are not significant. Okay. So as you can see, we got the third one, which is significant, is not touching the line. Okay, the risk ratio line. We got also this one over here. But when we are really interested, we look at the total of all these studies. Okay, so as you can see here, these rhomboids is the total of these all these studies, and is touching the line, so it means that it is not significant. And then we got the other forest plot, again in the same forest plot, which is about the physical activity. So is actually the athletes. So these are the 5 studies that are carried out on the athlete, and as you can see, there is a strong significance. And overall, there is some significance in incidence of cold when you take 0.2 grams per day of vitamin C. So it seems to have some sort of effect. Okay. Now the second forest plot, as you can see, this is for the duration of cold occurring when you are on regular 0.2 grams per day of vitamin C. So this is the duration of common cold, and as you can see here, they are all significant. Okay, so that's why the author stated that it might have a significant effect on the duration of cold. However, they are not replicated that consistently. So he stated that we might need more studies, basically. Now, vitamin C again is another. This is another meta-analysis, and this one was more recent. It's 2018, and is on 9 randomized controlled trials. So again, we want to look, when we do a meta-analysis, at randomized controlled trials, because they are the gold standard. Okay, and there they look at the vitamin C doses based as a therapeutical. They look at the therapeutical effects, of vitamin C with a daily supplementation, and if it's able to shorten the common cold. Okay, so we got the methods here. They use different database, really reliable. However, just 9 randomized controlled trials were meeting the criteria of this study. And they did the statistical analysis, the risk ratio was extrapolated, the mean, the standard deviation, and so on. So the conclusion is that I'm gonna drop it out my camera. The use of therapeutic doses of vitamin C during cold help alleviate chest pain, fever, and chills. It also shortened the indoor confinement. However, it doesn't reduce the mean and duration of cold. More studies are needed to assess the effectiveness of vitamin C in reducing the duration of cold. This is what the author stated. Okay, so let's have a look in more details at the forest plot, which we like it a lot. So as you can see here again, this is a different study. Here, as you can see, there are some studies missing, okay, and this is because we will look at the limitation later on. They didn't meet a certain criteria. So I don't know how relevant is this significance, because we are missing some of the studies. So these highlight some of the critical questions that we need to ask ourselves when we look at this type of studies. So here again, they look at vitamin C, and as you can see here, regular taking plus therapeutic doses, they seem to be significant. However, when we just give therapeutic doses of vitamin C, these are not significant. And this one was a forest plot on duration. Okay, so the mean duration, it wasn't significantly reduced with vitamin C. And as you can see here, this is the total of both, okay, and it's not significant. However, it seems that if you take it regularly, then vitamin C can help you reduce the cold. And this is because your body, and this is coming into place, personalized nutrition, guys, your body is working properly, okay, because you're feeding him every day with the right amount of micronutrients, okay? So that's why it's so important, nutrition. Now, vitamin C and upper respiratory tract infection, again, this is another forest plot, and this is on nasal congestion and runny nose. And they didn't see any significant difference between placebo and treatment, between the one that are regularly taking vitamin C and the one that is using just therapeutic doses. So it wasn't significant. Then we got sore throat, and this again, it wasn't significant. Same, neither in the population that was taking vitamin C every day and therapeutic doses, and the therapeutic doses group. Then here is where things start to be a bit more interesting. Okay, so we got fever, chest pain, chills, and depression, and all of them are significant, a part of depression. So depression, the mental state didn't differ. Okay, but as you can see here, these studies is only in 2 studies. So it means that this study were the only study that were looking at this means, okay, so fever, chest pain, chills, and depression. These were the only study that were assessing for these outcomes. So it's only 2 studies, so we can't base our understanding and knowledge on just 2 studies. So this is a poor translation, okay? Now, again, muscle aches, there was no significant reduction, sorry, and again, it's only 2 studies, so we need more studies to assess all of these. And then indoor confinement, okay, so the duration of the indoor confinement, and I drop off again my cameras, as you can see, is significant in total, okay. However, the one that was using therapeutic doses was only 2 studies, okay, and then in the regular taking were 4 studies, which again doesn't make really sense, okay. So this is a quite poor, again, translation and meta-analysis, okay. They just try to find an outcome, basically. And as you can see here, the indoor confinement in the regular taking and therapeutic doses actually was significant, but that doesn't mean the duration of cold it's improved. It's not true. It's just that people tend to have maybe less symptoms, okay, after whatever. So it's helping with symptoms, but the cold is not disappeared. So they might start to go out because they feel better, but it doesn't mean that the duration of cold dropped, okay? Now, so what are the limitations of the last meta-analysis that we look at? Because it wasn't a really strong meta-analysis. So they didn't account it for age and sex, which is so important, because age is really important, because a 70 years old person, okay, has a completely different immune system than 20 years old. Okay, 20 years old is much better at fighting different pathogens, okay, than a 70 years old. That's why also fever vaccine and like COVID right now are mainly for over 70, 60 and so on, okay? Then this was a relatively small meta-analysis, with only 9 studies, and even the author highlighted that 3 of the studies were not as strong. So meta-analysis really rely on the quality of the study that they scout. Okay, so if you have poor studies to start with, then the outcome will be poor. Okay, so it's so important that when they do a meta-analysis, they pick the right studies. Okay, that's why they have the inclusion, exclusion criteria, and so on. The data in some cases has to be calculated instead of extrapolated directly, because the study weren't looking at the mean that the meta-analysis was looking for, so they didn't have the same outcomes. Often the data was not suitable for a meta-analysis, but it was more descriptive. So even again, this is a big limitation. How can you do a run conclusion if it's a descriptive test? Then no appropriated data on vitamin C dosages was extrapolated. So how much vitamin C do they need? I don't know, 10 milligrams, 200 milligrams, 1 gram per day, okay? So there was no recommendation. And also the author stated as well that vitamin C reduced the mean duration of cold. And he stated that it actually reduced the duration of cold. However, when we see at the forest plot that we just look at they improve the indoor confinement and so on, and we look at before at the mean duration of cold, the duration of indoor confinement was improved. It's true, but that is not necessarily associated with the cold duration. Okay, so that's not really indicative. Okay, so what are the conclusions of today? So vitamin C, nevertheless, is an important antioxidant and is a cofactor, as we said, in collagen synthesis, which is so important, and is so important in many physiological reactions, also in carnitine, so the transport of fatty acid and so on. So it's a really important micronutrient. It's essential for collagen synthesis, so repair of tissues, and also sport and so on performances. And now we go into the cold again. So there were mixed results in terms of effectiveness of vitamin C in treating cold, and it doesn't not prevent cold at all. However, it is helpful in reducing some of the symptoms. Okay, so that's why it's so important to have enough micronutrients and zero concentration level of micronutrients in our body. It means that every day you don't need to take vitamin C just when you have cold. You should take it every day. Okay, so you should have a good amount of vitamin C every day. So, and also what it was scary from this presentation, we know that in many low medium income countries the population is deficient in vitamin C, which means that they are going through different different type symptoms of scurvy, which as we saw, they're terrible. So guys, make sure to help the third world countries. Okay, so the low medium income countries, when you can donate guys, okay, to help them feed the less lucky. Okay, and then more randomized controlled trials and stricter design are needed to better understand what is vitamin C doing in terms of cold prevention. Okay, so overall, what we can say about vitamin C and cold: vitamin C and cold is not really working. Okay, so it's just a way for pharmaceutical company to sell their product. So, oh, they put vitamin C, you think that something is added, is working better, so you buy this brand rather than the other brand. Okay, they base their claim on some scientific backgrounds and studies. However, the study design and the type of study are questionable. Okay, so be always critical and always try to do your own research or speak with people that knows what they're talking about. Okay, so in terms of, again, what is important that you nourish yourself with the right food every day, the right intake of everything, and remember, you're not the same with another person. So what are the intakes for, I don't know, Angela is completely different from the intakes of Maria. Okay, so you need to understand that we are all different, okay, and we all have different needs. Okay, so that's why it's so important personalized nutrition. That's why it's so important that you understand better yourself and experiment safely on yourself. Okay, so try to go and see professional people in different fields to better understand yourself. It's an exploration of yourself. How exciting it is to knowing more about yourself every time. Okay, and also, who doesn't want to be the best version of themselves? So as the year pass by, you may increase your lifespan, okay, increase your performances, increase your career performances, just because you know better yourself and you're able to have more clarity, get everything in place, stay young forever. Okay, so don't forget about nutrition, guys. Anyway, after this, I'm done, guys. I hope you enjoyed the presentation of today. If you need any help, I'm here for you. You can DM me on Instagram, YouTube. You can leave some comment. Please share, guys. Share, like it, comment. Help me with the algorithm. So everybody are gonna know about vitamin C. Everybody are gonna know a bit better about themselves, and they can start exploring and be the best version of themselves. Okay. Again, I'm Filippo Ceccagno. If you need any more help, you can look at the reference list. So I will sweep on the reference list. Here we go. And that's it, guys. I'll see you the next time. Follow me, because more things are coming. See you later.